I'm better than most.
I just like to sing the song from
Ever
Karate
feel
Kid.
nervous talking to someone new?
Oh, right.
So I'm talking to someone who's
I got this.
a medical person or professional.
Dinosaur.
Yeah, with like a pound of sugar at the bottom. Say what you're thinking. That's great.
3 minutes to leaving.
You already got a half a cup. So, you just keep pouring it on top there.
Yeah.
Do a half a cup. Keep it new.
You know what that's from? 3 minutes to leaving.
Do you want some?
Oh, yeah.
Right, yeah, the next two.
I haven't seen that movie in ages.
You add more sugar to it or no?
No, no sugar.
I put them in there.
How's the
I've got
coffee?
enough milk to make introduce that before we do the scene.
Okay.
The too dark?
Yeah.
Well, hello
You're
everyone.
crazy,
Thank you so much for
Hello.
having us. My name is Melissa Redwin and I'm with Enchanted Circle Theater. And we are an arts integration professional theater company. And so we take theater and the arts and apply content to it. So sometimes we're doing healthcare, sometimes we're doing science with young people, sometimes we're doing poetry with adults through the public library. We do all kinds of things and work with folks from age 1 to 99. And so it's really a privilege to be here, and I'm working with my new cohort. Will you want to introduce yourself, Kelsey?
Sure. Hi everyone, I'm Kelsey, and it's so great to be here, and I'm really looking forward to getting to know all of you as well. I work at a company that's called CommunicateHealth, and as you might guess from the title, we are all about communicating health in a really clear way for people. A lot of the people that I work with understand that sometimes health can get really complicated, and sometimes it can make us feel nervous. Sometimes we feel a little bit better if we're a little bit more informed about our body or what our doctor is telling us. So that's a little bit about my background, and I also used to do a little bit of theater, so I'm excited to be here with Melissa today, incorporating some arts into our health class.
So this is a health class, and it's about self-advocacy. And we're going to talk about what self-advocacy is. And we'll be working together. We'll have our lunch break. We'll work all the way up to 1. So today's about self-advocacy in healthcare settings. So we're going to talk about primary care, like having a doctor that is your primary care doctor. Some of us have one, some of us don't. I'm transitioning right now and trying to find my primary care doctor. Some of us may be doing that. Going into the ER for an emergency, or going to the pharmacy for a medication that you have a prescription for. How can we self-advocate? And what does that mean exactly? And we're going to be getting some information today, something called a health toolkit. And inside it defines self-advocacy. And it means kind of the opposite of what, a lot of times what may happen to me and what may happen to some of you is I feel disempowered in those situations with the doctor. I feel like maybe I'm not being listened to very well, or maybe they don't really have time for me. So self-advocacy is about speaking up for ourselves and what's important to me and urgent for me right now. It's about being able to make my own decision, what's best for me and my health, with the guidance of people who know a lot about healthcare. It's also about learning who you have on your team. Who are the support people that care about you, that can give you guidance, that can give you a ride, that can take care of your kid while you're at the doctor. All of these people help enable you to take care of your health. And it's also about knowing your responsibilities. Taking my medication, eating healthy, working on my healthcare plan for my diabetes or whatever illness I may have or a condition I may have. So really taking responsibility for my own care and for people around me as well.
Hi, I'm Danny, and this is William's pen.
That's William.
Hi, my name is William. I got Naomi's pen. Whoops!
Corey's a cop.
Yep.
Okay.
So, just taking this one step further and seeing how connected we had to be and how we had to help each other out, how does that work in life? The people in our community, how do they help us out? How do we help them out?
Opening doors.
Opening doors for people?
Helping them
Yeah,
cross the
Sarah.
street.
I volunteer in my neighborhood.
Volunteering?
I got a lot of elderly
Yeah.
living around my area.
Yeah, folks that need a little extra help, whether it be physical help or
Yeah,
crossing the
I-
street.
I helped a lady with her groceries one time in my complex,
Yeah,
stuff like that, you know, elderly lady.
excellent.
Snow blowing other people's driveways and sidewalks so they can get out of the house. And if they have an emergency, they can get an ambulance and go up their stairs.
Speaking of that, is it ever hard to reach out and ask for help?
Sometimes.
Yes, yes. Yeah,
Even when we know we need it?
But if you don't ask, you'll never know.
no.
Everybody needs help.
Yeah.
It doesn't matter who you are, what age you are,
I wanna do
whether you have physical ailments or
like
not.
that.
Everybody needs help and everybody's capable of giving help as well.
Yep,
Yeah.
I did a lot of help here. They all helped me.
Excellent. And you help them, I'm sure.
Oh, yeah.
Mm-hmm.
Yep, yep.
So everyone will get one of these folders, and this is the health toolkit that Melissa mentioned a minute ago. And in just a second, we'll talk a little bit more about what's inside. So I was wondering, what comes to mind when we think of the word toolkit, besides the shed or
Tools to work with,
tools to work with?
yeah. You get
Tools
them,
that could help you out?
yeah, things that you can also get at work, school, college.
Mm-hmm.
It doesn't, like you said, it doesn't have to be a mechanic tool.
Right.
Verbally, written, reading,
Sure.
all
So
that good stuff.
verbal, written
Yeah.
tools and resources that can help.
Correct.
Anyone else? That was a pretty thorough answer. Thank you. So in this toolkit, please go ahead and open it up and we can take a quick look through it together. And there's a few pages inside here, and throughout the day, the activities that we do will correspond to some of the blank worksheets that are in the toolkit. But the real purpose of this toolkit is to serve as a guide that you can use to help you feel a little bit more informed and in control of your health information. Like I said earlier, sometimes when we get to a doctor's appointment, suddenly, this has happened to me before, where my mind goes blank and I can't remember my question anymore.
So we're talking about a lot of different situations that people experience, how challenging it is to find a primary care doctor who does follow up with you, that you feel like you can connect with. Some people have found this, some people haven't. It is possible. I do. So this support map is part of self-advocacy. You're not alone. You're not doing it alone. And if you know you need to find more people that can give me good advice or that can give me a ride, that's something to be looking out for. And if you're filling this out and you see that there's a blank spot, you're like, okay, that's what I need to keep my eye out for. Is there somebody I interact with that could give me a ride sometimes? Is there somebody I interact with that I help out a lot, but they could probably help me too, you know? Building the support network is part of what helps us be able to give ourselves the best health care that we can, both physically and mentally. Thanks for playing with this. So this goes in your toolkit. Okay, so since it might depend on your insurance, some people are going to the doctor, some people are going to a pharmacy or some other place that's offering flu shots, which so many places do, right?
Why don't we have
pay cash?
Yep.
Pay cash, yeah. So that depends on, so can I put it between?
Yeah,
Right.
weekly.
How about the health center?
Oh, yep, could be the health center. They might, yeah.
Healthy eating tips for diabetes.
Or for some other condition that,
Doctor.
Doctor, phone, health center.
Your doctor is supposed to direct you towards healthy eating tips and lifestyle choices and exercise, and has materials for you to read, could potentially refer you to a nutritionist. So absolutely, a doctor could help you and should be helping you with your overall
Yes,
plan.
he should, yes.
Absolutely. So what is the best way or the worst way I could walk into my doctor's appointment? Or into the pharmacy, or into the ER? The best way or the worst way? You could be smiling. Yeah. So I'm gonna do a little scenario, and I'd just like you guys to give me some tips, some thoughts about how I could improve my entrance and exit to my healthcare appointment. So y'all might have to turn around.
Breathe. Thanks. Same phone number, same address? Excuse me.
Yeah.
Same phone number, same address?
Yes, it's right there.
Yeah.
Okay.
What time is your appointment?
Dr. Fitzgerald,
Okay.
8:30?
Yep.
I know I'm a little bit late.
All right, well, we'll be a couple minutes anyways. I'll call you when we're ready.
Thanks.
Now
Okay.
you better start typing, Destiny.
All right. How did
Wow,
I do?
Dustin, have you done that job before? That was really good.
Great job. How did I do?
Wonderful.
Well,
Oh, thank you. So, was that of the best way or the worst way or somewhere in
Apparently for you, it was
between?
the only way.
funny,
What emotions were coming up from me?
a lot,
The chest pains.
What?
a lot.
A lot of
What
emotions.
emotions?
What kind of emotion? Name an emotion.
You were rushing because you were already late.
I was rushing, I was late. Yeah.
Trying to think of it as an emotion.
Emotion or,
Yeah, like what's the word for it?
yeah.
Panic,
Panic.
Sound like
Yeah.
anxiety
Yep.
going on there.
anxiety, that's a good one.
Anxiety, absolutely.
Yep.
Winded.
I was winded. That's
Yeah.
you even told me to breathe.
Stressed.
Stressed. Okay. So what should I do to feel less anxious or to calm down and be less stressed, less
Make better
rushed?
time.
Come a little earlier. Time management. Right.
Maybe you have 4 kids, you're not used to taking time for yourself.
Maybe I just missed the bus I was supposed to get on.
Or you could call them and tell them you're gonna be late.
Oh, good idea. Slowly and slowly. Who else has an affirmation or a mantra that they say to themselves when they're feeling anxious or like a little scared?
I can do it.
I can do it.
Yeah.
Yeah.
I can do it.
We're gonna pass around a few more affirmations. Write down one that you like. Write down one that resonates with you, that feels right to you. I can do it. I can be myself and make mistakes. What's another one?
This too shall pass.
This too shall pass.
I use that a lot.
Yeah,
That's strange. I
yeah.
say that a lot
Everything's temporary.
to myself. So,
Kate. Add.
Whoa.
Kate.
Add.
Vote.
Kate.
Add.
whoa.
Kate. Add. Well. Kate.
Good. Breeze. Add. Okay. Not bad. I'm not going to act in this one. I'm going to help sculpt their statue. So before we even improvise a scene, and you don't have to memorize any lines, this is just coming up with a very short scene. It could be 20 seconds long, okay? Where something's happening. So we're going to pick a picture, and we're going to pick maybe one of these cards. Okay, so we're going to have 2 things in our group. And the first thing we do is create, here, read it out loud.
Patient clearly says, "This makes me nervous," and the doctor slows down, becomes more gentle.
So the patient says,
Oh, this
Give me
is.
your arm.
Calm down. That makes me nervous.
so it's hard to say that something makes you nervous or that something makes you a little scared or whatever it is. But when you say it, the doctor will be like, oh, I'm being too rough, or, you know.
Reflect on themselves.
They
I
will
take that as a
reflect.
threat.
They need to reflect, yeah. So I'm gonna help sculpt you guys into a statue based on this picture, okay? So, okay.
Alright.
I'm your doctor,
Hi.
and them two are my, one's my assistant and a nurse. And, where's your straw, Lois? Huh? Where's your straw? In my pocket.
have to give her a shot.
I have to give you a shot.
Oh. Oh, the flu shot.
And, it might sting a little bit.
Will it hurt?
Not really,
Not really?
no.
Okay. Is there anything I can do that might help me calm down? I'm feeling really nervous. I don't like shots at all.
Don't look at it.
Don't look at it.
Or close your eyes.
Okay.
Yeah, close your eyes.
Okay. Let me know when you're going to do it,
I'm
please.
gonna do it.
Do it, close your eyes. Relax.
Did you do it?
Yeah.
Oh, I didn't even feel it.
We both saw it.
Hi, Melissa. Oh,
Dr.
Melissa. Hi, Dr. Santa Claus. Oh,
I'm Mike.
I'm Dave.
Now you need to find somebody.
Hi, Melissa.
And where are you going?
So,
Good
you
to see
need
you.
somebody.
Great guy.
Okay, now you
Thank
can
you.
hire Kelsey.
I'm Mike.
Yeah.
My name's George. Hey, George.
Nick,
Good to see you again.
Kelsey.
How are you?
Speak out words that you're thinking or feeling looking around at this group.
Awkward silence.
Nice group.
Nice
Yeah.
group.
How's everybody doing?
Very good.
Just one word. Sunny.
Santa Claus. Sunny.
Peachy.
Okay, hold on. There's some serious words coming.
Bonding.
Bonding.
Yeah.
Strong friendship.
Friendship.
Everlasting.
Say yours again.
Connected.
Connected.
Trustworthy.
Responsibility.
Yeah.
Time consuming.
No.
Individuals.
It is time consuming.
Good support.
We're very reliant on
Be
each
care for
other.
each other. Yeah. We're supporting each other right now.
Nice. Yeah. So we are constantly building this web, this network, and it's very meaningful. And it means we have good health, and it means not just individually, but our community is healthy.
Yes.
You can let go. Thank you, everyone, so much for your work today.
Kathy, put it on